Hey, this is Dr. Ben Pearl with Fitfoot U. So today I have an old classmate and a podiatrist in Silver Spring, Maryland that is suffering plantar fasciitis. So we're going to talk about two things today. We just got the new Brooks Ghost, and it has nitrogen-infused EVA and a rocker glide. And I want to get your impression of what you think of this shoe and how you've used it.
Okay, well, when I first got it, I had a plantar fascial tear, actually. History of plantar fasciitis. I have my orthotic in here. Performance orthotics are in here. And I usually like the Brooks Adrenaline, but the Ghost Max by Brooks has a lot more cushion in it to really help plantar injuries. And I feel this is a real good go-to shoe for people that pronate, that have plantar foot pain at the heel or even at the ball of the foot, stress fractures. Great shoe. And would like to even have another one.
And the thing about it is it's high octane on the EVA with the nitrogen infusion. It torques a little bit, but not much, very wide base. And the other thing about it, as you're walking, you'll feel that rocker effect, which is going to put more of the stress through the midfoot and away from the heel and away from the toes. So this is also a great shoe for turf toe if you haven't used it for your patients there. Well, once it comes out, it's pre-release right now, and we've got a chance to try it. You're also doing something else, Steve. This is electromagnetic therapy, and this is really your first session on your plantar fasciitis. So
Plantar fascial tear.
Yeah, your plantar fascial tear. So this is going to be interesting to me how you respond to it. This with an acute tear that you've had, let's say, how many weeks ago was it?
I was around 6 or 7.
Yeah.
And this was one of the therapies, actually, wearing this.
Yeah. So with an acute situation, I would expect a better return with an electromagnetic therapy. The more chronic a condition is, the tougher it is. Of course, you had something profound, a tear, but it'll be interesting to me to see how many treatments it would take for you to respond, and I'll be interested how, let's say, tomorrow and the next day it feels, because there's sometimes a delayed effect to what you feel. But what are you experiencing right now?
I feel working gets a little numb, but that's okay.
Yeah, it does kind of draw the blood,
Right,
because of the charge of the electromagnetic field.
right. And I had a lot of compensation pain where it was affecting the lateral dorsocutaneous nerve as it is going from sural nerve to that. So I'm trying to make sure this device is giving me treatment there, which is usually not a symptom of plantar fasciitis. But
That's why he has it angled slightly biased to the outside. He's
Right.
inverted his foot a little bit.
because I was compensating quite a bit for the medial side.
So we'll have a follow-up session with Dr. Blanken after he's had a chance to see how it works after a couple days. Till next time, this is Dr. Ben Pearl with Dr. Steve Blanken with Fitfoot U.